Today we are at Lokichogio Mixed Comprehensive School in Lokichogio Sub-County. We are providing free medical services, courtesy of the Mpesa Foundation and Zuri Health. And so far it is about midday and we have seen over 1,000 patients, which is a very impactful camp. This serves as a very important area because it is at a border between Kenya and South Sudan. So there's a lot of cross-border people coming in from South Sudan into Turkana to get services. So right now we've seen some patients with different diseases, from respiratory tract infections to cholera to issues with the NCD. So far it has been successful. It's a bit hot, as we can see here, but we are glad to be here. Just to give a background of what we are offering at the camp today, we are offering a wide range of services, from doctor consultation to the triage to the lab, where we have different tests like HbA1c, kidney and liver function tests, as well as the test for lipid profile and total blood count. Additionally, we have the women's health section, where we're able to provide services to women in all the different ages, from the children up until the elderly ladies, from getting their pap smears done, family planning, and also ensuring that they get to do their breast and cervical cancer screening. But of course, the men are not left out. We get to do prostate cancer screening for the men here as well. In addition to the services that we have here, we are offering optical and dental services, which is something that is very sought after in remote areas like this. We can see the burden of health, and also there's also the issues of poverty, making sure that people are not able to get services when they need it. And finally, there's also a rise in malnutrition in the children. So we also focus on ensuring that we provide supplements to these children and ensuring that they are given the support that they need.
We have up to now been able to see about 1,500 people, and more are coming. And the medical camp has a unique feature where all the information is captured digitally, and this information, as per patient, will be made available to the health ministry in this county, and therefore they'll be able to follow up any cases that require to be followed up. We've also committed to funding the registration of 20 people on SHA, which we do in all our camps, and particularly we pick those who have long-term conditions who require SHA support in meeting their medical expenses. So we have committed to paying for 20, as will be identified by the doctors, for a period of 1 year to support follow-up. Turkana, the substantial population here are nomadic, they're pastoral communities. And one of the key takeaways for us, that next time we are doing a medical camp, is to make sure that we are able to capture even the male, because the male normally go out to herd their livestock. And the way to capture them is, one, to ensure that a medical camp starts very early in the morning.
Na tuko hapa kwa uwanja wa mpira wa Lokichogio Mixed Primary School. Tuko hapa kwa sababu ya matibabu ya bure, Mpesa Foundation na Zuri Health. Nimepewa matibabu ya kifua, nimepigwa x-ray, nimetibiwa, nimepata matibabu, pia malaria nimetibiwa, nimepata madawa. Siko sawa kabisa kwa sababu imetusaidia si wale wengine wenye hatujiwezi kwenda hospitali ya pesa. Tukienda huko wanatuhitaji pesa mingi, lakini hapa tumesaidika kwa bure bilashi. Nawashukuru sana watu wa Mpesa Foundation na Zuri Health. Tunashukuru sana kwa msaada wenu ambayo mmetusaidia kwa siku ya leo. Na pia tunasema next time kuja tena mtusaidie.
Na tuko hapa hivi kwa huduma ya Mpesa Foundation and Zuri Health. Tulikuja hapa saa 2 na sasa ni muda wa saa 10 kwa sasa. Matibabu yamekuwa ikienda salama, yamekuwa ikienda sabamba na hatujaona ungumu kwa access anywhere. Mimi nilikuwa nimekuja check up na nimehudumiwa na huduma imeenda sawa, nimefurahia na ndio tumetoka kumaliza, ingawaje bado wengine wanaendelea, lakini mimi ndio nimetoka kumaliziwa kwa sasa.
So far, we've seen so many people. They've managed to come to attend this camp. And on my side, I've seen a good number of eye problems, and we were able to screen them. Right now, we are over close to 400, and there are so many people still coming, patients. Among the cases that I've seen, quite a number of them, because of the area is so dry, there is a lot of dust, it's so windy, so there are many people suffering from allergic conjunctivitis. We had enough medication, and we've given to those patients who had those allergic conjunctivitis. There are also elderly patients, some majority of them who have poor vision, and I've seen it's because of the cataracts, which we are also going to do surgeries on them. Once we book, we make sure also the other conditions like blood pressures, the sugars are stable, and then we have a list we've generated, and we are going to have surgeries on those patients. So we thank so much the sponsors, Safaricom Mpesa Foundation, Zuri Health, Lion Side First Eye Hospital, also the host county government of Turkana and its leadership. We want to give thanks to them, and so we asking them to continue, because these problems, there are so many areas we need to cover. So we are requesting maybe for another camp, maybe come next year for this exercise to continue. Thank you so much.